feel that this was a program and a profession that was needed for Pakistan. There are programs around the country that are hybrid programs that claim or say that they are dental hygiene programs, but they are also terming or naming them as a dental technician program. We are a dental hygiene program. We are the first of its kind in the subcontinent, and we are very true to the profession. Our program at the Aga Khan University is comparable to international standards. We have looked at international standards and modified them for our global institution. We are a global institution, so we have catered it so that students from all of our sister countries curriculum. Many of our applicants come from Pakistan, from rural and remote areas, as well as East Africa. We have 3 students so far that have come through our program. We currently have 2 from Kenya, and we are really looking forward to candidates or having candidates from other countries such as Tajikistan and Afghanistan. We also want Uganda and Tanzania. We are really looking for students to come and participate because these are countries that need preventive care as well. For those of you who may not know about our teaching facilities, we truly are state-of-the-art. Our facilities, our simulation lab, you will see pictures of in just a little bit. If you apply and are a candidate in our program, you will get to learn from the best facilities really in the world. And I'm really proud to say that because being in Pakistan, we are extremely fortunate to have the state-of-the-art facilities that we provide for our students. We also have rural community learning experiences and emphasis on community health. A lot of what dental hygiene is prevention, and we accommodate and we really gear our students to be community health educators and providers. And as we are looking down the road, this will probably be more of an emphasis as we grow as a program. Our students are very fortunate with our faculty. Our faculty are those who teach in nursing, and with our Sonam faculty, the School of Nursing and Midwifery. The Sonam program has been around for a very long time. It has a very good reputation. Partners, a lot of our classes are taken with our Sonam partners. We also have our local dental faculty. But we have about 5 faculty members from AKU, as well as dentistry and dental hygiene online faculty that are volunteer faculty from other international institutions. So we really do provide a very well-rounded group of faculty and teachers to teach our students. Even though we are a new program, it is a solid program in that the content and the teaching is geared towards the students, and it is student-centered and learning-centered. After our students graduate, we also offer our students a 1 to 2 year internship program within AKU and within our sister entity, the Aga Khan Health Services Pakistan. So all of our students are then accommodated after. So who is a dental hygienist and what is their role? Okay, dental hygienists are highly trained dental practitioners who provide oral health care to their patients. Okay, the health care that they provide are oral health screenings, okay, reviewing health histories, big oral cancer screenings, head and neck inspections, because we know that in our region, in Southeast Asia and South Central Asia, in the Central Asian countries, that head and neck cancers are the highest globally. Pakistan especially ranks amongst the highest worldwide in head and neck cancers. And as preventive specialists, we train our students so that they can detect and screen for head and neck cancers. We also teach dental charting. We also teach our students how to develop and interpret dental x-rays, and we have on-site facilities for this. We have labs to teach students how to take x-rays. We are also a competency-based program. That means that everything that we teach is a process. It is a process by how a student learns, how a teacher teaches the material. So we have processes in place to make sure that our students are really engaged and that they're really learning. Dental hygienists also educate patients on clinical oral findings such as periodontal disease or gingivitis, or whether they have tooth decay. We train our students to really assess for these and educate our patients, removing calculus and plaque, hard and soft deposits, and then applying preventive materials such as sealants and fluorides on patients' teeth, as well as providing oral hygiene education. And this is a huge part of what we do as preventive specialists, is we provide education and knowledge to our, not only to our patients in clinic, but to the community at large as well. We have a large nutritional counseling component, so you will know how to provide for nutrition in the local as well as the global context as well. Once you graduate, what are your opportunities? What are your prospects, and what is the scope of dental hygiene? As I say, dental hygiene has been in this country, but our program is fairly new and we are still establishing the profession. We want to set a standard for care in the country because we are very meticulous, we are very detailed about how we want this program and profession to be addressed for the larger population of Pakistan and worldwide, really. Our dental hygiene program allows our graduates to work in a variety of settings. We have a student or a graduate that works in a hospital setting currently. We have our internship program that is a hybrid of the clinical setting where they see patients in our clinic. Our students and our interns also partake in research, and they are also building capacities. So we are teaching them how to be educators, dental hygiene educators, because we want our students to then come back and teach within our own program. We also have Aga Khan Health Services Pakistan, where a lot of our graduates are now working all over the country. And so we are very fortunate to have this partnership with AKHSP, and they have really been a very good supporter of us, and our student feedback has been that they have learned a lot working with Aga Khan Health Services Pakistan. Some of our students have also gone into dental clinics, into private dental clinics. We have reached out to many dentists in the area to create jobs, and this has been one of our mandates, is to really create jobs for our graduates because the jobs were not there. So what we have done, Dr. Saida, myself, and many of the dentists at AKU have really gone out and spoken to dentists and said, we have a great program, a great dental hygiene program. And now what we are finding is that there are so many jobs that we have created, but we do not have graduates to place into these jobs. So if you're listening and if you're interested, you can be rest assured that you will have a job after you graduate, because there are many dentists that are looking for qualified dental hygienists. And as we speak and as we really embark and advance the profession, I think dentists themselves are seeing the value of our graduates, because they are seeing how meticulous and well-rounded they are when they graduate. So they are really taking a keen interest in selecting our graduates and having our graduates work with them. And here is a good example of one of our graduates, Ms. Uzma Kul, who is now working with Dr. Amreen Afzal. Dr. Amreen Afzal is a trained orthodontist, and she is also a member of the CPSP. Dr. Afzal is one of our biggest supporters, and she really believes in dental hygiene, and this has been a great partnership in the country. But Dr. Amreen Afzal is one of the many dentists to recognize the program and the profession, and are coming back and saying, we want to hire more graduates. Can you find someone else? And we have, we don't have enough graduates to place. So this is a very good example of how our program and profession is evolving. You may have questions about our admission. Is that students who apply have a 50% minimum aggregate in pre-medical subjects coming out of high school. And then for your AKU admissions, there is a two-part process, which includes submitting an online application and then taking an AKU undergraduate admissions test for the ASDH program. Those who are then shortlisted are then invited for an interview, and it is a two-panel interview, and then the final selection is made about a month and a half before we let you know. So this is a process, and it is also available. The process is it's available for you online at our website, and you are more than welcome to access the online reference or also get in touch with someone at the registrar's office. We also have a process for our non-Pakistani candidates, and we go through what we call the IBCC process, which we can explain to you. If anyone has a question, we can cover that for you at the end of the seminar. We're more than happy to let you know what the process is. This is the fee structure for the two-year program, and this is also available online. So you may want to look at this online and for your own purposes. And this is the website that we support that is provided to you. We also have scholarships, and the information for scholarships is already online for those students that are accepted. So I want you to know that financial assistance and scholarship for those eligible are available. We want to give you a little bit of an understanding of what it is like to be a student at AKU. These are some of our students in our sim lab. As you can see from the very little that you can see, it is state-of-the-art. It is one of the only kinds of simulation practice lab for dentistry in the continent. No other country, no other program in the continent has a simulation lab such as what we have. And we are extremely proud, like I said, to have our students. And our students are very grateful to learn from our simulation lab, because the process in which we teach is that we provide for theory and classroom teaching, and then practice. So everything that you learn in our theory classes is then exercised on the simulation models, as you can see here. And then we take the information or the application and transfer it into clinic. So we do not go from class to clinic and start working on patients right away. It is a process, and we make sure that our students are adequately prepared before they see patients. They work on each other, they work with the faculty, we assess for any deficiencies or any gaps, and really making sure that the student is prepared to see patients. And so the simulation is just an added bonus to how our students learn. Here's another picture. And the reason why I wanted to show this picture is to show you how the student is working in a simulated environment. These are mannequins. We have 16 mannequins in our sim lab, and these mimic a real patient. And so, students can practice, and there is not a problem and it's just like working on a real patient. And you can see that we have the screens in the back. This is our founding director, Dr. Saida Rasool, Dr. Munawar and then over here, Dr. Fahad Mer, that is our pathology faculty and our section head, Dr. Ali Sadek. We work within a team. BDS is a Bachelor's of Science in Dentistry, and it is a program that trains you to be a dental professional or a dentist. We are a dental to be preventive specialists that work with a dentist or with the community at large. So there are two separate distinctions. Many times people get confused with that, but we want you to understand that there is a difference between being a dental assistant who works hand in hand with a dentist and then a dental hygienist who works independently of a dentist.
Great. Next question is, would this program ever evolve into a degree program?
Yes, we are very hopeful that this will evolve into a four-year degree. You see, there is a need for us to really provide for comprehensive services for Pakistan, for other countries in the region. We recognize that, you know, there is so much more that as a profession and as a program we can contribute toward. We are looking as we speak into expanding the program. We are hoping that we are not too far away from this, but we do want to develop the program into a degree program because we do recognize the need for it. We know why it is so important to have a four-year degree. And as a matter of fact, we have always wanted a four-year degree program for the dental hygiene program at AKU, but we had to start with very basic baby steps and making sure that we were aligned with the overall notion of where we were going as far as the profession in the country. So this is something that we are working on actively. We have been working on it. We will continue working on it. And we are on the trajectory of making it into a degree program with other modalities built in so that we can provide for broader services to make it a broader scope of the dental hygiene program, and potentially looking at a practitioner model or a dental therapy model. So yes.
Okay, great. So next question is, does our FSC marks matters for being in merit or only entry test matters?
So that is a question for Navin. Navin, can you help us with the question?
Yes. So see, your high school percentage is required for eligibility purpose. This determines whether you can apply for the program or not. That is used as a qualifying bar. But after that, your evaluation will be based on the Aga Khan University's test and interviews.
Okay, let's continue. The next question is, if the isolation is gonna last longer for entrance test, we have to come or we have to give it online?
So as far as now, our information which we have received is this, that our test will not be online. Everything will be on a paper-based form, that the way it was before. But we will make sure that it has been all the infectious control to provide a better and a suitable environment for our applicants.
See if we have any questions, or we have received the questions earlier before the webinar session when you have registered yourself. So, Ma'am Salima, if you allow, can we take those questions?
Sure.
Okay. The first question is, can I apply for this course? I'm doing a job as senior assistant in same institute.
Yes, so our guidelines are the same for any persons applying into the program. They have to have the scores, they have to have the admissions test, they have to follow the processes that you would have for any other candidate applying into the program. So yes, anybody can apply, but there is a process and tests that they would have
Okay.
to pass.
And next question is, what about financial aid policy and about hostel?
Navin, can
Yes, so for
you?
financial assistance, students who cannot afford the fee can always apply for it after getting admission. So first you need to make sure that you are eligible to apply, you get admission, and then there's a separate entity that deals with the financial assistance. The whole format and the procedure is available on our website. I would really suggest and recommend that you guys should go and check it out from our website. And for hostels, it is available for students who are coming to us from outside Karachi. So it's available for everybody who is in Pakistan outside Karachi, and as well as for people who are coming uh, from an international country.
Thank you, Naveen. Let's continue. Next question is, what about the seats for male?
Oh, yes. So AKU does not bias gender, religion, any of those factors. We encourage male participants or male candidates to apply. We are looking for a diverse class. That means that we are looking for male, female. We're looking for all diasporas. We're looking for applicants from anywhere around the world who can contribute to our rich diversity.
Is there any age limit to apply?
No, there is no age limit. As long as you have 50%.
Okay. So, do they specialize in everything?
So again, this is a profession and a program on its own, independent of dentistry. Generally, when we say, do they specialize, it is generally referred to dentistry as being more specialized in areas of pediatrics, oral surgery, orthodontics. I hope that I've made it very clear that the dental hygiene team as a team. And so again, we see patients on our own, and no, we do not specialize because we are a holistic program teaching preventive care.
Great. Next question is, what we can further opt for a higher degree education after holding certificate of ASDH?
Right. So you could apply to a bachelor's program, but as we have mentioned, we are currently working on expanding the program to a 4-year degree. We might be a couple of years away, but that will be our transition for all of our graduates so far who have come through our program to then transition or to take the remainder of the courses that they might not have covered into the bachelor's program. Alternatively, students can look into bachelor's program, or once they graduate from a bachelor's program, they can also go on to a master's. So that is what we are trying to align ourselves with, is to really create a degree program and then have pathways for our students to then go on to graduate programs. We will need graduates going on to higher degrees and coming back so that they then can also be part of the profession and the program.
Thank you, ma'am Salima. Next question is, can I continue this course with my job, doing job in same institute and dental department? I have done my FSC pre-medical.
Yeah, so the answer to that is no. This is a full-time program. You dedicate 2 years just as nursing, just as medicine, to come and learn from us full-time. It is not a part-time program, and most programs around the world are full-time programs. So we require that you attend classes and that you complete all the coursework, and it is formulated so that you can follow along the way all the courses that are provided to you. So no, it is a full-time program, and it is 4 semesters at this time, but it could be longer in the future.
All right. So do we have any more questions so we can take it? Okay, next question is, how many held annually for ASDH course?
So we are looking at a maximum of 10, a class of 10. And the reason why we can only take 10 is because our facilities only allow for us to teach 10 students at a time. With simulation, we're able to accommodate more, but we also share our space, our teaching space, with our dental section, our dental clinic at AKU with the hospital, and therefore we borrow space from them, and they have been very kind and accommodating to give us the chairs that we need. But we have configured this to only 10 students in each class at this time. So we are looking for 10 students, 10 qualifying students.
Great. So let's wait. So I didn't receive any more questions. So are we ending this question and answer session?
So I have had I have had a question come to me, and the question is, how many students completed their ASDH last year at AKU? We graduated 8 students last year in our program, and so far to date we've had 35 students graduate from the program, and about 6 at the end of this year or whenever convocation will come, hopefully, inshallah. And so I hope that I answered. I hope I answered that question as to how many students have completed last year, and that was 8.
So I have received one more. What are the subjects taught in this program?
The subjects. Okay, so we work with the SONEM and the School of Nursing to provide for a lot of our auxiliary classes, educational technology. We have Islamiyat, we have anatomy, physiology, and then we come into, depending on the semester, every semester we have a 3-credit class on theory. We also have simulation and practice, which accounts for about 9 hours during the week. We have your basic dental sciences and natural sciences as well. Your basic dental sciences are your anatomies, your microbiology, immunology, pathology, periodontology. We also have a 3-semester community health and leadership class. We also have classes with SONEM. Other than that, on English, one of the benefits of coming to AKU is that you have English classes along the way each semester, and our students are taught how to write, academic writing, scientific writing, grammar, it's fairly well-rounded. It's comprehensive, and so those are some of the classes that you will take if you are a candidate and if you're in our program.
Great. Next question is, I have taken the entry exam once and passed. If I am to apply again, do I have to do this again?
Can I answer this question?
Yes,
Sure.
Navin.
Okay, so the test is applicable for only in the year which it is written. So you have to reappear for our test.
Okay. So can I continue with the other questions?
Yes, sure.
Thank you, Naveen. What is the logic of taking mathematics questions include in test paper being a medical student?
Okay, yeah, I can answer that. So usually when you apply to any university or any institution of higher learning, institutions are looking for well-rounded individuals. And so that encompasses not just English because you speak English, or science because it is science related. A lot of what we do is mathematically based. For example, in community health and leadership, there are classes and courses in biostatistics. This is where you apply your math skills. Similarly, with other classes, math just makes our lives easier. And if you're good at math, or if you know a little bit about math, I think that is important. And so therefore, when we are looking at candidates, we're looking for a well-rounded candidate who is, who has basic knowledge of English, speaking and writing, and then science as well as math.
Okay. Next question is, what are the jobs you get after completing this ASDH program?
Yeah, so like I said, one of our graduates is working in a hospital. Some of our graduates work in community settings, and some of our graduates are also working in private dental clinics. And as I mentioned earlier, we have created jobs for this, and we are looking to place our graduates into these clinics so that they can then start building on the profession.
Great. Let's see. Salima, if you have received any further question on your chat window.
Let me see. So I do have a.
I just got one that, can you please guide me about test pattern for AKU?
I'm sorry, what was that?
No, the question is already answered. It's about the test pattern, which we have already discussed.
Okay. It looks like there's 2 more questions on here.
If you won't be able to pass the math part and get number in other parts, are you still going to fail us or pass us?
Well, hello. Well, I would suggest you to prepare for all the subjects in the test because it is essential to pass all the components.
Okay. And what about if a person is not good in English speaking, even he is best in all subjects? What about the selection?
If a person is not a good English speaker, even if it's best, well, it would depend on your scores on the English test. This is the reason why we would have you test through English, and if you pass the English test, then that is the criteria that the university sets for all individuals. So yeah, it is a criteria set by the university and not the program specifically.
Great. Let's see if we have further questions. Does AKU provide job to their own students who graduated from AKU through this program?
Actually, because the profession is new, we have had to go and create jobs. And like I said earlier, we have created jobs. We have many dentists in the community that now want to hire our graduates. So, but we do not have enough graduates now to give to for them to employ. So we're looking for more candidates to graduate from the program. There is a need for more graduates. There is a need for more people to graduate from our program. So please apply if you can. Please tell your friends about this because it is a growing profession. There are jobs, and so we are looking for candidates. So if you feel that you are someone that likes to work with people, that likes to work with others, that you are interested in science and learning about a new profession, then I would highly recommend that you look into the testing processes. Yeah.
Great. So I didn't receive any further question.
There's one question here which says, I'm living in Karachi with my family. So can I continue this course, live with my family, or is it mandatory to live in the hostel?
Yes. So if you are a Karachiite, you can continue living with your family. We have many students from Karachi that continue living at home with their. You are not bound or obliged to live at the hostel if you choose not to. In fact, if you have family in Karachi, you may not get a seating at the hostel. The hostel is for those who do not have family or who come from out of town. So if you're a Karachiite, chances are you are staying at home with your family. So yes.
Okay. And there is a question, how long is this program?
It's 4 semesters, 2 years in total.
And then there is, if I'm not a good English speaker, can I still cope with this subject? As in, can I also get along well with all?
So this is a broader question in that AKU teaches in the English medium. We are an international university and our courses are all in English across the institution. So again, you would have to test through our English admissions test, and then pass the interview processes, and then we would select you whether you are a candidate for the program or not. But because it is taught in English, it is somewhat a requirement that you be proficient in speaking and writing English.
Okay, great. So we are taking like a repeated question because of the internet issue with some of the candidates. They're asking that what are the job opportunities after graduating from the AKU, and what would be the salary package being given after completing this course?
Yeah, so I think we've already talked about the jobs, and the salary would really depend on the dental setting that they apply to once they are in the job market.
Okay, and is there any scholarship given to these students?
Right, we've already covered that, and there's information for that online and at the registrar's office as well.
Okay, and they're also asking what questions are asked during the interview.
The questions really vary from year to year and from the panelists that are on the committee. We have various faculty that are on the committee, and each year they have questions regarding the candidate themselves, how they would see themselves in certain settings, how they would go about solving problems, what they see for the community at large, how do they see themselves providing for care or being stewards of the community. We are looking for individuals who really want to provide to others. We are looking for individuals that want to care for others. Just as nursing and just as medicine, it's really no difference. And so the interview process is really a way for us to see whether you will really be the graduate that the profession seeks of you to be. So that is what I would say is the questions are reflective of the profession and the program.